New Journeys is the name of Washington's own coordinated specialty care model for first episode psychosis. The model aims to make early identification and treatment of psychosis a universal healthcare practice. The sooner individuals experiencing psychosis are routed to appropriate care, the better. The National Institute for Mental Health defines psychosis as a collection of symptoms that affect the mind, where there has been some loss of contact with reality. During an episode of psychosis, a person's thoughts and perceptions are disrupted, and they may have difficulty realizing what is real and what is not. People may experience symptoms of psychosis or psychotic-like experiences for many reasons. Psychotic-like experiences, or PLEs, can be seen in the diagnoses of trauma, autism, depression, substance use and withdrawal, and some medical conditions. New Journeys targets symptoms of psychosis related to schizophrenia spectrum diagnoses, major depression with psychotic features, and bipolar disorder with psychotic features. When talking about psychosis, you may have heard the terms positive symptoms and negative symptoms. Positive symptoms can be thought of as adding something to an individual's experience, such as hallucinations or delusions, while negative symptoms can be thought of as taking something away from an individual's experiences. When thinking of positive symptoms include those hallucinations and delusions. Hallucinations are sensory experiences in the absence of sensory stimuli. In schizophrenia spectrum disorders, these are most likely to be auditory. Delusions or ideas of reference are strong feelings or beliefs that something is real despite no supporting evidence. These are often bizarre in nature, not just a different way of thinking compared to an individual's peers or family. An example could be that by the way that cars are parked outside of somebody's house means that they're being tracked by the government. Disorganized symptoms include things like confused thinking and other cognitive deficits. These may include new and unraveling difficulties with attention, working memory, learning, and processing speed. We may also see disorganized behavior exhibited through behaviors that are incongruent or inappropriate to a situation. We see disorganized speech, which includes loose associations, word salad, or repeating words and phrases. Negative symptoms, again, can be thought of as taking away something from an individual's experience. These can be things like decline in social functioning, lack of energy, lack of motivation, a decline in expressiveness, and slowed motor functioning. Individuals who experience psychosis may also experience symptoms of depression and anxiety. Individuals who are diagnosed with psychosis may have an increase in suicidal thinking compared to their peers who do not experience psychosis. These experiences may or may not be related to the delusions and hallucinations that they're experiencing. Psychosis is more common than many people think. Each year, approximately 100,000 young people in the United States experience a first episode of psychosis. Many of these individuals and families go without care for long periods of time. In the United States, the average duration of untreated psychosis, or DUP, is more than 2 years. This is in spite of the fact that the World Health Organization suggests that specialty care for first episode psychosis start within 3 months of the illness onset. Here's why that's a serious problem. Longer DUP contributes to more frequent relapse, a longer course of illness, more profound disability over time, and risk of premature death. Negative outcomes tend to cluster in early psychosis, including symptomatic relapse, rehospitalization, depressive episodes, and suicide and self-injury. These outcomes are exacerbated by the increased duration of untreated psychosis. The historical school of thought has been that once somebody is diagnosed with schizophrenia, they are subject to a lifetime of disability and should sign up for Social Security, that they may need to take medications for the rest of their life, and that they may never return to work. This is simply not true. Many people who experience schizophrenia can and do live successful lives, and they do achieve a functional recovery. Research in this area has shown that both medication and psychosocial interventions have the greatest potency in earlier illness onset, leading to the development of coordinated specialty care models to target symptoms within the first 2 to 3 years of the onset of an illness. Research has shown that engagement in coordinated specialty care models like Navigate and New Journeys leads to better treatment outcomes, reduction in symptoms, and overall improved functional outcomes. In 2015, Washington adopted the Navigate model, which was used in the RAISE trials, and it is now known as New Journeys. New Journeys deploys a multidisciplinary team who uses a coordinated approach to provide person-centered, evidence-based care for individuals with first episode psychosis. The wheel on this slide demonstrates a multidisciplinary approach used by our New Journeys teams. They wrap around an individual and their family to provide support in managing symptoms and helping an individual get back on track with their normal developmental trajectory. Services can be provided wherever an individual is most comfortable. This could be in the individual's home, at school, at work, in the community, or in a clinic setting. Our teams use a no wrong door approach to accessing services. And teams complete their own screening and differential diagnosis. This leads to more accurate diagnoses and connection to services based on an individual's needs. As we think about making early identification and screening of psychosis a universal healthcare practice, it's very important that we engage with primary care clinics for early identification to ensure that individuals who are presenting to their clinics may be screened and routed to appropriate care earlier on in their illness onset. The mnemonic facts can be helpful in knowing the indications for psychosis screening in your clinics. If your teams are seeing a functional decline, atypical perceptual changes, cognitive difficulties, thought disturbance, or change in speech, this may indicate additional screening for psychosis is warranted. The graphic on this slide was taken from psychosisscreening.org and is available to be accessed by the general public. On this website, there are multiple screening tools that can be used in a primary care setting to assist in decreasing DUP and routing individuals to treatment earlier in the course of their illness. As mentioned earlier, psychosis and psychotic-like experiences are associated with a number of diagnoses and have various underlying causes. Primary psychosis is a symptom of psychiatric disorder. It is important that adequate differential diagnosis is completed in order to route individuals to proper care. New Journeys team members receive specialized training in differential diagnosis of psychosis and can assist in diagnosis as needed. New Journeys teams serve individuals experiencing psychosis due to schizophrenia, schizoaffective disorder, schizophreniform disorder, brief psychotic disorder, and delusional disorder. Our teams have recently expanded their capacity to also support individuals experiencing bipolar disorder with psychotic features and major depression with psychotic features. If a primary diagnosis of psychosis is suspected, there are tools that can be used to assist in screening. If you can have the patient fill out a self-report questionnaire, such as the PQB, self-report does tend to be an accurate measure of individuals' internal experiences. If somebody is scoring positive on the PQB, please route them to the nearest New Journeys team. There are also observer-informant reports, like the Early Detection and Primary Care Checklist. This has been shown to serve as a pretty good screener for further assessment. The PCCL is a short 20-item checklist that emphasizes observable criteria as opposed to internal experiences, which makes it easier for an observer, such as a primary care physician or parent, to fill out. Secondary psychoses can be seen in the case of substance-induced psychosis and certain medical conditions. In these scenarios, it is most appropriate for an individual to receive treatment for the underlying cause of their psychosis rather than being referred to a New Journeys team. The reference on this slide provides an excellent medical workup for psychosis, which can be used in a primary care setting. As a reminder, New Journeys teams are trained in differential diagnosis. If you are seeing someone who is reporting symptoms of psychosis, they are between the ages of 15 and 40 and have been experiencing psychosis between 1 week and 2 years, please consider referring them to New Journeys for additional screening. There are currently 20 New Journeys teams across 15 agencies in our state. These teams are in various stages of implementation, as indicated by the legend on this map. Sites are launched based on incidence and population data from Medicaid, which ensure that there is adequate access to care for those in need across the state of Washington. Additional information on current locations, as well as the contact information for our New Journeys teams, can be found on our website, newjourneyswashington.org. If there is a New Journeys team in your area, I would encourage you to reach out to the program director of that team and invite them to an in-service or staff lunch to talk more to your staff about New Journeys and how to make a referral. Referrals can be made directly to a New Journeys team or via the New Journeys website. When referrals are made on the New Journeys website, they are viewed by a member of the University of Washington Spirit Center and routed to the appropriate team. On the slide here, there are links for an excellent two-part recording hosted by the Northwest Mental Health Technology Transfer Center. This recording focuses on the management of psychosis in a primary care setting. This can be a resource for ongoing learning as it provides additional insights that were not covered in this presentation. Thank you for your attention. If you'd like to learn more about early intervention for psychosis in Washington, please visit our website or contact a New Journeys team in your region for more information.